These particles are not only hard to detect, but at least in some cases, may be normal organelles, not HTLV3/lab viruses. Furthermore, particle aggregation and budding have been proposed to be determined by actin-myosin interaction. It is of interest to note that actin-myosin interaction, particle aggregation and budding can be all induced by oxidizing agents. Most importantly, in vitro cultures with normal cells, virus-free, can be induced to produce particles which resemble RNA tumor viruses in every physical and chemical respect. Aronson et al., discussing their particular experiments, can find only two explanations for this apparently universal phenomena. The first was a chronic, low-level virus infection in the original primary embryo culture which could not be detected by the methods available. Under this hypothesis, the virus could have persisted in a carrier state, because there always were a few infected cells in the population. The second explanation was that virus began spontaneously in previously virus-free cells during the course of establishment of the cell lines. These findings provide strong support for the second model. Although the retroviruses can arise spontaneously in virus-free cell cultures, the rate of appearance can be increased a millionfold by the use of radiation chemical mutagens or infection of the culture with other viruses. Weiss et al. In a paper entitled Induction of Avian Tumor Viruses in Normal Cells by Physical and Chemical Carcinogens conclude, the mechanism of induction is unknown. It is attractive to imagine that the endogenous viral genome exists as an integral part of the host cell chromosome, but there is little evidence for this assumption. We call them RNA tumor viruses in a taxonomic, rather than an etiological sense. One can plausibly argue that the derepression of natural endogenous viruses is the result, not the cause of neoplastic changes. 89. At present, the French believe that the AIDS virus does not belong to the superfamily of leukemia viruses, but is in fact a member of the lentivirus family of retroviruses as exemplified by Visnavirus. 90. As far as the present discussion is concerned, this makes no difference. Induction of the Visnavirus as well as other viruses also requires in vitro activation. Of pivotal significance to the present discussion is the fact that the isolation and cytopathic effect of HTLV3/lab can be obtained and observed only in cells activated with various mutagenic agents such as CONA, THA, and irradiation. Notwithstanding, heroic measures such as pooling of AIDS sera, manipulation of culture conditions and selection of cell lines are necessary to isolate a virus. After all these conditions are satisfied, only a small proportion of these cells is infected by the virus. At the peak of virus replication, only 5 to 10% of the cells express viral antigen. Furthermore, only 10 to 20% of clones derived from the SEM-T4 cell line are susceptible to lab infection, even though they all express the T4 molecule on their surface. Meanwhile, the non-stimulated AIDS cultures behave like normal cell cultures in respect to HTLV3/lab infection, that is, there is no infection. On the other hand, HTLV3/lab has been isolated from mutagenically stimulated cultures from cells lacking both HTLV3/lab DNA and RNA. In a paper published this year in which Gallo was a co-author, it is stated, in the present study T4 cells from normal donors that were infected with HTLV3 in vitro, after stimulation with FA, followed the same pattern of secretion of 1L2, day 1, production of HTLV3 and cell death, that is the same pattern as FA-stimulated cells from AIDS donors. Whereas the same infected cells did not produce IL-2 or express virus without immunological activation, FA stimulation. Since this is the case, even assuming that HTLV3/lab exists in vivo, and is transmitted from a sick individual to a normal one, the normal person would never become ill unless he is exposed to high concentrations of mutagenic agents. In other words, HTLV3/Lab by itself cannot produce ill effects, while the metagenic agents would produce the immunological and clinical abnormalities associated with AIDS irrespective of HTLV3/Lab infection. It is important to note that in the above-mentioned paper evidence is present that FA produces immunological abnormalities in normal non-infected cell cultures, including T4 loss. CONA is also immunosuppressive both in vivo and in vitro. Equally important is the fact that when normal T and B lymphocytes are stimulated either in vivo or in vitro with CONA, they display viral antigens on their surfaces. The situation is as follows. There are two agents, A, HTLV3/Lab, and B, sperm nitrites, opiates, factor VE. However, only B is pathogenic on its own. Yet A is considered as the primary causative agent. This becomes even less probable if one realizes that the methods for the detection of A are non-specific. Because the AIDS patients are also exposed to metagenic agents, activation of different viruses can be expected. Thus, unlike the HTLV3/Lab infected T4 cells hypothesis, these metagenic agents could account for both the viral activation and the AIDS-related malignancies. Furthermore, the metagenic agents, being oxidizing agents, can also account for the cellular immunosuppression observed in these patients. The lymphocytes have a relatively high negative charge. Their functions, including response to mutagens, reset formation, suppressor/helper activity, and natural killer cell activity, depend on this negative charge. Oxidation leads to suppression of the above activities. As has been pointed out earlier, the absolute lymphopenia, preferential decrease in T4 cell numbers, and the inversion of the T4/T8 ratio is not specific to AIDS but is widespread, and exists in many diseases without retrovirus infection. In AIDS, these abnormalities in T cell numbers could be real or apparent and result from I. The extremely high sensitivity of T cells to oxidative stress, i.e. T4 cells having a lower negative charge than the T8 cells could be the first to be destroyed by persistent oxidative stress. E.e. The T4 cells could be preferentially sequestrated in diseased peripheral tissues. If the binding of antibodies to the cell surface depends on the environmental redox state and the relative charge between the cell, negative, and antibody, positive, surface antigen and binding of antibodies decreasing with cellular oxidation. Modification of the environmental conditions leads to changes in the T4/T8 ratio in a given population of lymphocytes. AIDS in non-homosexuals. According to Gallo and his group, epidemiological studies carried out chiefly by the Centers for Disease Control in Atlanta, Georgia, particularly those pertaining to transmission of the disease by filtered factor VE in blood transfusion cases, strongly implicated a viral agent as etiological factor of AIDS. It seems logical, and has been already stated by Gordon, that this finding is, however, also compatible with the possibility that factor VE induces immunosuppression without the intervention of an infectious agent. The evidence available in the literature supports this latter interpretation. 70% of hemophiliacs have been reported as being seropositive for HTLV3 infection, as compared to about 45% of the randomly selected homosexual group from an area of high AIDS incidence. But only 0.06% of hemophiliacs develop the disease. Like in all other AIDS patients, the virus in these groups has been isolated only in vitro. Factor VE has been found to be immunosuppressive both in vitro and in vivo, the T4/T8 ratio being inversely correlated with the quantity of factor VE concentrate administered. The in vivo studies led the authors to conclude, it is difficult to explain